Thank you, Mr. Chairman, and I thank you for having this hearing, and also thank you to the witnesses for your work as well as for being here today. I think it's been said, but I certainly agree that the rollout of the Affordable Care Act has been, the website in particular, has been just a disaster, and I think all of us find it totally unacceptable that we would be in this position. And while the ACA offers many benefits to millions of Americans, I've repeatedly said that there are provisions that need to be fixed, there are unintended consequences that need to be dealt with, and we need to move on that, I think, in a bipartisan manner in this Congress. And now we come to a potential new problem. We don't know the magnitude of it because it's early days, and obviously, since so many people have not been able to get on the website, we really don't know yet how much personal information might be at risk. Americans are putting data in order to even begin the process that is very sensitive information. And I do share the Chairman's concern that the Department of Health and Human Services has a very poor record of cybersecurity, generally speaking, and now, of course, more information than ever before is going to be available through their system. I think American people, generally speaking, are very concerned about their privacy on a number of levels. I mean, we can go into other areas, we won't today, but this is a new area of concern. So having said that, I really believe that unless we can give some assurances that the privacy of information in Healthcare.gov is adequately protected, it will undermine the American people's confidence in that system, and they may choose not to even explore their benefits that are available on that website when it gets fixed. So having said that, Ms. Stempfli, your office is responsible for maintaining the security, reliability, and resilience of our nation's cyber and communications infrastructure. And this oversight and general maintenance obviously pertains to our critical infrastructure, but it also pertains to the security of Federal Government's cyber networks, which interface with private sector and with individual users who access Federal Government websites. I would agree, I hope you would agree, must be vigilant in monitoring and upgrading our systems and design them to be as ironclad and as impenetrable as possible, particularly those systems that house sensitive user data such as Healthcare.gov. Now, having said that, Ms. Stempfli, could you talk in very specific ways about the steps that your office has taken to ensure that data that is inputted by American people into the Healthcare.gov network, how it has been protected or will be protected, and how have your actions been informed by the attempted incursions that you talked about earlier?
Sir, the Department of Homeland Security's engagement with the Department of Health and Human Services has been about general threat information, provision of best practices, and a requirement for compliance reporting. We have provided a verification that Health and Human Services has complied with the domain name security. That's a set of technologies that translate Internet addresses, the machine-readable information, to human-readable. So when you type www.google.com, the Internet knows how to translate that. So we've been able to provide verification that they have complied with that level of security in their environment as well. However, we've not been in a specific architectural conversation with the Department of Health and Human Services on this application.
Have you had any discussions with Health and Human Services subsequent to identifying, as you said, perhaps 16 incursions, actual or attempted?
We have had an operational conversation between their Security Operations Center and our U.S. CERT about these particular activities. And as I pointed out, these are under investigation. These reports came in the November 6th, 7th, and 8th timeframe. So there's a period of time where we have to go through a verification and determination. Yeah,
I appreciate that you have to check in to make sure that you have you can verify what's really going on. But I would urge you, obviously, to speed up that process, because if and when the website is fully operational, and we're told it will be operational by December, I would expect we'll see many more, and we need to be prepared for that. And I guess my final question is, what plans do you have for ongoing monitoring of the security of the website?
I appreciate the question, sir. A set of capabilities that the department provides, including one you may know of as Einstein intrusion detection capabilities, the Center for Medicare and Medicaid Services will be moving its applications behind in the second quarter of calendar year 13. HHS has been active in attempting to get behind this capability, but had to work through some specific statutory language that was in their statutes. And given that I know this committee has been supportive of, we've been trying to work to get some positive authorization language for these DHS programs that would have shortened that time frame. Additionally, they've agreed to be an early adopter of the continuous diagnostics and mitigation capability, and so we're anxious to get that provided to them. The contract is due to be released today or tomorrow for the acquisition of those capabilities.
Thank you for the extra time, Mr. Chairman. I yield back.
Yeah, let me thank the gentleman for raising one issue, and that is, Einstein's been around for a while, and it seems to me that it should have been applied to this website and to HHS. And I think anything we can do to expedite that would certainly be in the best interest of the United States. So